Okay, I am back. I took a little swig of my Pepsi and continue on. Now, this segment of the video is, this segment of the video goes over this particular video is going to be the midterm review. Okay, so midterm is week 5. This pretty much affects, I believe, the Tuesday's class. Let me not just say that to confuse anybody, but in any event, this is the midterm review. So for the midterm, just to make sure that you understand, you are responsible for chapters 1, the information that's in chapter 4, chapter 7, chapters 10, chapter 11, 14, 15, 16, and 18 and 20. So we have a good amount of information that's going to make up our midterm exam. Okay. Now for the midterm exam, please understand that the information will be definitely case study format type questions, much like the stuff that you've had already. We will also have pictures. It would also include laboratory values, okay, that I went over with you guys. We will also have yes NCLEX style questions again. Please keep in mind that all of the information from all of the chapters can be combined in questions. So we can have a question where a patient can, yes, have a leukemia and at the same time maybe have some sort of DIC that may be going on. Okay, so just try to be able to take the information from each and every condition that we went over. Please get creative when you're practicing at home with writing your case studies with the information so you can really get a good understanding of how to blend the information, okay? So let me just kind of take this chapter by chapter, and I'm not going to lecture again, but I just want to kind of hit some highlights just to kind of give you a guideline to prepare yourself for the midterm, okay? Now, please make sure that you go over all of the images that we've gone over so far with class. So the images that you are responsible for are definitely the images that go over all of the cellular adaptations. You are responsible for all of the images that include the necrosis and gangrene. You are also responsible for all of the images on the histology slides of leukemia. And you are also responsible for the pictures of the coagulation disorders, okay, bleeding disorders. So the petechiae, the purpura, ecchymosis, hematoma, so all of those pictures you're responsible for. So up into the coagulation disorders, those are the pictures that you're responsible for, and that's that. Now, as far as the laboratory reference guide, okay, there are some things that I did tell you to highlight. Please make sure you have the correct things highlighted. So let me just review. You are responsible to know platelet count. You are responsible for red blood cell count, white blood cell count, white blood cell differential. Okay, so that is all on the first page. The second page, we don't have anything. The third page, you are responsible for knowing the lipid panel. And again, I am only holding responsible for the desirable amounts. I'm not holding responsible for the borderline and panic or whatever, high risk. But make sure you know the desirable amounts. I am also holding responsible for, on the next page, cardiac markers. You are responsible to know that information. And you are also responsible for knowing blood clotting assessment. Okay, and I went over that with you in chapter 14, the INR, the PTT, and the PT. Okay, please make sure you also know bleeding time, and I gave you that information in chapter 14, which goes over, yes, bleeding time, which is between 3 to 9.5 minutes. And then make sure you also know the blood pressure classification chart, which is in your book, that you're also responsible for. It's not here, but it's in your book. And I think that was it as far as numbers. So, I have my binder here, as you can see. I try to keep myself organized, so I have here pathophysiology lesson plan. So I have each week all the chapters and PowerPoints that I go over with you guys, and even all the assignments and stuff that I like to do in class. So I'm going to take this week by week. Okay, and as you can see, this binder is very thick. Okay, and that's the whole term. So for week 1, we went over chapters 1, 4, and 7. So with chapter 1, I do want you guys to please go over all of the same information that we went over. Chapter 1 just basically went over just terminology, what's the etiology, risk factor. Make sure you know the difference between a sign and a symptom. Make sure you know the different levels of prevention. So everything that you studied for week 1, quiz, same situation. Okay, so nothing different. Chapter 4, with this chapter we went over different types of cell injury. So go over irreversible, reversible cell injury. Please make sure you go over the different types of cellular adaptations and their pictures that are associated with them. And keep in mind that these cellular adaptations, make sure you know all the examples, because we will go over in the future, and I think we've gone over some diseases that do incorporate some of those cellular adaptations. So be able to use those examples. Okay, that was that. Chapter 7 went over neoplasia. So with this chapter, please keep in mind that you do have to know everything that there is to know about benign and malignant tumors. Make sure you go over all of the nomenclature. The other thing is make sure you go over all the risk factors. You are responsible for also knowing staging and grading, the warning signs of cancer. Everything that we've talked about with cancer, please make sure you know it. Okay, so even the complications of cancer, the bone marrow suppression, even please review some of the treatment measurements, okay, that we went over. So remember that neoplasia, that chapter sort of set the stage for the information that we went over in week 2, okay? So 1, 4, and 7, that was week 1, so that's the information that I need you to know. Now week 2, we went over chapters 11 and 12. And so with those chapters, please make sure the same thing that you study, everything that there is to know about leukemias. We were able to break them down very nicely with going over the risk, not so many risk factors, but going over the pathogenesis. We had hallmarks, we had certain signs and symptoms that were with these different leukemias and lymphomas, and certain treatment measurements. So please go over all of that, same process of the way you studied for that week's test. Also the pictures, make sure you know the pictures that are associated with this information. Okay. With leukemias, let me just say this while I'm thinking about it. With leukemias and even HIV and AIDS, now that we have our laboratory values under our belt, there could be case study type questions that could involve these lab values. Okay, so we can add in lab values now to leukemias in patients with with HIV and AIDS questions. So for chapter 12, HIV and AIDS, keep in mind, same thing that we went over before, know the modes of transmission, prevention. Make sure you please know the different categories of the CD4 counts. Please remember those, and not only just remember those levels or those categories, but make sure you know which diseases fall under those categories. And the tests you guys just took, had that information in it. Make sure you also know which diseases fall under what is considered AIDS-related diseases, okay? So there's just diseases that are just for AIDS patients. And make sure you also go over the different testing, okay? So different testing and understanding what the testing is used for, okay, and how the testing is done, which I think everybody's pretty good with that information. Okay, so I think that was it for that chapter. I think we were good with that. So that was week 2. Week 2 was 11 and 12, and leukemias took up a lot of our time that week. So that was week 2. Week 3, which is the week that we just had. And with this week, chapters 14, 15, and 16. So with chapters 14, 15, and 16, I will say this. Make sure you know everything that there is to know about the blood coagulation cascade, normal coagulation cascade. Make sure you know the 2 drugs, Coumadin and also heparin, and how they interfere with the coagulation cascade. Make sure you go over how you would evaluate a patient for hemostasis. So making sure that you go through the family history, any past diseases such as liver disease and things like that. Making sure you also know the different physical findings on skin. And then please go over the laboratory testing, which we went over with the reference guide, and then they also go over that a little bit in the PowerPoint as well. All of that information can be included with the case study type question, so understand that information is very important with the evaluation and laboratory tests. Now, make sure you go over each and every vascular, platelet, coagulation disorder that we went over with that chapter. Okay, so it's nothing really to pinpoint. Please go over each and every one, know the difference. Most of the signs and symptoms are the same, they're just bleeding. Okay, it's just a matter of where and what type of bleeding. But it is the same, signs and symptoms. So just please go over each and every one and know the differences. With chapter 15, this chapter wasn't that much, but we went over basic blood flow, and we talked about what happens when there's an obstruction of blood flow. So please make sure you know everything there is to know about having an obstruction in arterial flow and obstruction in the venous flow. 2 different things that can happen. We know that arterial would lead to ischemia, and venous flow would lead to edema. Now, the other thing that I want you to focus on too is make sure you know the difference between a thrombus and an embolus. Make sure that you review pretty much everything that we've been over as far as vessels and inflammation and vasospasm, what happens with headaches. Okay, so everything that we talked about, arteriosclerosis, arthrosclerosis, we even talked about aneurysms. So make sure you go over each and everything that we discussed. We also focused on 4 main diseases. We focused on Berger's disease, Raynaud syndrome, and we also focused on aneurysms as well. Sorry, 5 really. And then we also talked about varicose veins and DVT. Now there was one thing I forgot to tell you, and I just remembered this morning for the Thursday's class. When I talked about deep vein thrombosis, DVT, okay, so how these patients can have a blood clot in the leg, one thing I forgot to tell you is that a major complication of DVT is that these patients could have a pulmonary embolism, okay? And this is what they try to stop from happening when these patients do get diagnosed with a DVT. So please make sure you jot this down and get it, that a complication of a DVT is a pulmonary embolism. And I think most of you guys may know that already, but I have to just tell you that information. Okay, so that was it for 15. 15, everything was there, okay? Everything that we talked about, okay, so just review. 16, same situation with blood pressure. Please make sure that you go over all of the normal physiological mechanisms of how the body raises blood pressure. And please go over the following medications, such as beta blockers, ACE inhibitors, and diuretics. And those medications, make sure you know how they inhibit or how they block the normal pathway. Make sure you go over everything that there is to know about hypertension as far as some of the risk factors we talked about, whether they're modifiable or non-modifiable. Make sure you go over that blood pressure classification chart that's in your book, which is table 16-2. Make sure you know those categories. That's extremely important. And make sure you know the difference between primary and secondary hypertension, and obviously make sure you know the complications of hypertension, which are the different in-organ damages, such as the kidneys, the eyes, the heart, okay, vessels. So make sure you go through all of that information. And just review, just in case if I have a question about hypotension, okay, so orthostatic hypotension, when blood pressure is low. Okay, so make sure you review that information as well. So that was week, confusing my weeks now. Okay, yeah, that was week 3. So for week 4, which is the previous video recording that I had for you guys, which is chapter 18 and 20. So with chapter 18 and 20, please know everything there is to know about coronary heart disease. Okay, so starting from atherosclerosis, to how it affects the heart, to the different stages of the different categories of angina, what's the difference between acute coronary syndrome, chronic coronary syndrome. So everything that there is to know about the heart. So nothing here to really pinpoint. Please keep in mind that with this information, this is where I could use the lipid panel laboratory values to kind of tie into some questions with this, okay? Make sure you know the difference between the different types of MI, STMI, non-STMI. We went over that whole chart. Okay, that's in the video. Please make sure you know that. Keep in mind that also cardiac biomarkers, those laboratory values that I showed you can be used also with these questions, okay, for MI. Make sure you go over all of the valvular diseases, okay, so mitral valve prolapse, regurgitation, all that good stuff. Make sure you go over each and every one and understand what it's doing to the heart, okay, and the complications of it. Make sure you also go over the actual heart sounds as well, okay, so what does the heart sound like when it's going through this murmur? And then the last 2 things with 18 was talking about the different valvular diseases. The different valvular diseases, okay? Now, that was 18. So for 20, make sure you go through, and 20 went over shock, okay? So make sure you understand just the basic pathogenesis of shock. So what happens at a cellular level, so with the lactic acid and the free radicals and all that. Make sure you go through that information. And then with shock, we're just going to dive right into knowing the different types of shock. So know all the different types of shock that we went over. Make sure you know what categories they fall under. So make sure you know in detail cardiogenic shock, obstructive shock, hypovolemic shock, anaphylactic shock, and septic shock. Okay, so those 5 shocks, make sure you know in detail. Also, please make sure you know all of the complications of shock, okay, that can occur. So I can have a shock Okay, so say for example, hypovolemic, and then a person with hypovolemic shock could lead to a DIC, okay? So just make sure that you know how to incorporate some of those complications with the actual different types of shock. So you can just get creative again with writing some case studies with that information, okay? So that is the review for the midterm. Just to let you know, let me put this back in here. I think I told most of the classes this, but just to let you know, because I won't be here next week and there is no tutoring, I do have hangers over my office door. So if you go into the education suite, Patty's at the front desk where she can direct you to where my office is. It's the first office as soon as you turn the corner. And you'll see a hanger over the doorway there, right in the hallway. And it says for pathophysiology students, and I have there, excuse me, practice quizzes, practice case studies, and I also have some practice sort of like discussion questions. So some extra things just to add to help you guys prepare for the midterm. So even though I'm not physically going to be here to help you with the tutoring, but I do have enough practice assignments for you guys to do to prepare you and get you ready for the midterm. Okay, so you should be good to go. Also, please, again, don't forget to, you can email me at any time, even though, yes, I'll be away, I'll be in a different time zone. But you can email me, and I will answer you right away. I will be accessible via email, so there's no issues there. And just let me know if there's any problems, any concerns. And also, just to give you a heads up for week 5, and this only affects the Tuesday section, I am going to do a podcast, just an audio lecture of chapters 22 and 23 for week 5. Because of time, I won't be able to do an actual video, but you will still get it, but it'll just be audio, okay? So, and that will also be posted. So hopefully you guys got all the information from the videos. I hope this helps you. And good luck on your test, and I will see you when I get back.